Dementia is one of those words that sends a chill down the spine. When we think about it, the first image that likely comes to mind is a person struggling to remember where they placed their keys or forgetting the names of their loved ones. But what if I told you that dementia doesn't always begin with forgetfulness? The truth is, there are numerous early warning signs of dementia that are subtle, often ignored, and sometimes mistaken for normal aging. Understanding these signs could change everything when it comes to early detection and intervention. A silent threat. Why early signs are often overlooked. The most worrying aspect of dementia is how slow and subtle its progression can be. Early signs can often be brushed aside as simple forgetfulness, stress, or aging quirks. Society often associates dementia with memory loss, but the condition has far more layers than just that. By the time memory issues become obvious, the brain may already be significantly damaged. This makes early identification so critical, but the early warning signs are often elusive, even for doctors. I remember a case of an elderly woman named Martha who seemed to be perfectly healthy in the eyes of everyone around her. Her family noticed her becoming increasingly withdrawn, but they just assumed she was feeling a little more tired than usual. The truth? Martha was battling one of the earliest signs of dementia, apathy. Her family attributed her lack of interest in activities she once loved to fatigue, but this was actually an early sign of cognitive decline. Doctors too, especially if they're only seeing a patient for a short visit, may overlook signs that don't quite fit the textbook criteria for dementia. For instance, a person who seems withdrawn or lacks motivation may be misdiagnosed with depression rather than considered as possibly being in the early stages of dementia. But here's the issue. By the time these signs are dismissed or misinterpreted, brain damage can already be progressing. The earlier we catch these signs, the better the chances of slowing the disease. The surprising early signs of dementia. Dementia's early signs can manifest in many ways. Though memory loss is commonly associated with the condition, it's often only one of many symptoms. If you or loved one are experiencing any of the following, it could be an early indicator of dementia. Personality and mood changes. Subtle shifts in mood, such as irritability, unexplained anxiety, or sudden mood swings, are often overlooked. However, these mood changes may indicate that the brain is already experiencing dysfunction. In one instance, a man named Joe, who was usually calm and mild-mannered, became increasingly irritable over time. His family initially chalked it up to the stresses of getting older. But these behavioral changes were actually linked to early changes in his brain. Struggling to follow conversations. People with early-stage dementia may find it difficult to follow conversations, especially in noisy environments or during fast-paced discussions. If someone regularly seems lost in conversations, unable to contribute, or frequently asks for things to be repeated, it could be an early sign of cognitive decline. Difficulty with time management. A person may have trouble keeping track of time. Missing appointments, confusing the days of the week, or losing track of time could signal early changes in the brain that affect memory and organization. Decision-making challenges. Another early sign is trouble making even simple decisions. For instance, a person may be unsure about what clothes to wear or what to eat, not because they are forgetful, but because they are struggling to process information. Decreased sense of smell. A surprising and lesser-known symptom of early dementia, particularly Alzheimer's disease, is a diminished sense of smell. Research has shown that the inability to detect odors can be an early indicator of brain degeneration. Though not all patients with a reduced sense of smell develop dementia, it remains an important symptom to watch out for. The role of apathy in early dementia. One of the most commonly overlooked early signs of dementia is apathy, or a lack of interest or motivation. This is not the same as feeling lazy after a long day, nor is it like a passing phase of depression. Apathy is a profound disengagement from activities, relationships, and experiences that once brought joy. This is a sign that the brain's frontal lobes, responsible for decision-making, planning, and emotional engagement, are starting to deteriorate. Take, for example, a woman named Linda, who had always been the life of the party. She loved spending time with friends and going out. But over the course of several months, her family noticed that Linda started canceling plans and no longer wanted to engage with others. It was as though her personality had been replaced with indifference. This sudden lack of interest wasn't depression, it was early dementia. Apathy is often misinterpreted as laziness or depression, but it is a signal that the brain is struggling. This disconnect, this lack of motivation, can be an early red flag. The good news is that through therapies and engagement in activities that stimulate cognitive function, the effects of apathy can be mitigated. If caught early, cognitive decline can slow down, and a higher quality of life can be maintained. Subtle vision problems. What your eyes might tell you. Another surprising early symptom of dementia lies in changes in vision. People with early dementia may experience subtle difficulties with judging distances, recognizing faces, or perceiving depth. This is because dementia affects the brain's ability to process visual information. For example, a person might have trouble gauging the height of a step, leading them to stumble or trip. They may also struggle with tasks like parking a car or setting a table. These visual spatial challenges may be dismissed as common vision problems, but they can be early indicators that the brain's visual pathways are being affected. Regular eye exams and visits to neuro-ophthalmologists can help detect these early signs. Hearing loss. A silent risk factor. The connection between hearing loss and dementia may not be immediately obvious, but research has shown that hearing loss is a significant risk factor. Individuals with even mild hearing loss are at a much higher risk of developing dementia later in life. Why is this? When the brain struggles to process sounds, it diverts resources from other cognitive functions, like memory and decision-making. This can accelerate the brain's decline over time. Additionally, hearing loss often leads to social isolation. A person who has difficulty hearing may withdraw from conversations or avoid social settings altogether. This lack of social interaction can further reduce mental stimulation, which is crucial for keeping the brain sharp. Trusting your gut. How family members can make a difference. When it comes to early diagnosis, family members often have the upper hand. They are usually the first to notice subtle changes in behavior long before a doctor might detect them. This gut instinct can be invaluable when it comes to early detection. Family members notice when a loved one starts to act off, even if the changes are small. These early signs, though they may seem insignificant at first, can make a big difference if addressed early. For instance, noticing a loved one repeatedly forgetting tasks, avoiding conversations, or struggling with what used to be simple chores can be a sign that something is wrong. In one case, a daughter noticed her mother had stopped cooking meals, something she had always loved to do. At first, the daughter thought it was just a phase, but soon she realized that her mother's lack of interest in cooking was a sign of early dementia. By trusting their instincts, families can push for early medical evaluations, which could lead to timely interventions and better management of the disease. Conclusion. Taking early action. In conclusion, dementia is a disease that doesn't announce itself loudly. Its early signs often whisper, and because they are so subtle, they are easily dismissed or mistaken for something else. When we only focus on memory loss, we miss the broader picture of dementia, which includes mood swings, visual challenges, apathy, and even hearing loss. These signs are often misunderstood or ignored, allowing the disease to progress unnoticed. But recognizing and addressing these silent signs is crucial. Early detection allows for early interventions that can slow the progression of the disease and help individuals maintain a better quality of life. Apathy, vision issues, hearing loss, and subtle changes in behavior are all indicators that the brain is struggling. With the right attention, care, and support, dementia can be managed in its earliest stages. So, the next time you notice a loved one acting a little off, trust your instincts and act early. You might just catch the first signs of something far more serious, something that could be managed if recognized in time. Let's not wait until the signs are too obvious. Early action could make all the difference. Thank you for joining us today. If you found this information helpful, please like, share, and subscribe to our channel. Your support means the world to us and helps us continue creating content that empowers you on your health journey. Stay healthy, stay happy, and keep going.